Hi, my name's Dr. Gavin Chan from the Victorian Cosmetic Institute, and today I'll be talking about the Fraxel laser, and more specifically the new wavelength on the Fraxel laser, which is the 1927 nanometer wavelength. This is a new wavelength which was released about 1.5 years ago now. This laser wavelength was designed specifically for the treatment of sun damage, pigmentation, including melasma, which is a form of hormonal pigmentation. There is actually two wavelengths on the Fraxel laser. There's the 1550 nanometer wavelength, which we have another video on. But the main difference between the 1550 nanometer wavelength and the 1927 nanometer wavelength, which is the wavelength we're talking about, is that this wavelength really doesn't penetrate very deeply in the skin. It only penetrates 0.2 of a millimeter. Now you might wonder what the advantage of that is, but if you actually look at the skin, most of the problems within the skin, say sun damage or pigmentation, are actually within the very superficial layers. So it's not necessary for this laser to go very deeply to actually treat those problems. It actually covers a wider surface area than the 1550 nanometer wavelength, so you get more of a uniform cover. But it still has the fractional nature of the 1550 nanometer wavelength, which is that it won't treat every part of the skin. It will treat little columns of skin, but it will leave bits of skin in between, which help the treated parts heal, as well as reduce the risk from the treatment. Today we have Michaela, who's going to be our subject for the Fraxel treatment, the 1927 nanometer Fraxel treatment. And Michaela's main concern with her skin is her pigmentation. And she has a little bit of pigmentation over the cheeks and a little bit between the brows. This is an example of melasma, which is a hormonal type of pigmentation, and it usually occurs between the brows, on the cheeks, sometimes on the upper lip as well. There's also some sun damage on Michaela's skin, which would also benefit from treatment with the 1927 nanometer wavelength from the Fraxel. The skin also, as you get older, tends to lose its glow. It becomes more sallow, it loses its brightness, and one of the things the Fraxel laser will do on this patient is to improve the general glow of the skin. So she'll notice that really it almost appears like she's wearing makeup when she's not. The process of doing the Fraxel laser is firstly to apply the numbing cream to the skin, and that shine that you see at the moment is actually numbing cream, and that helps to reduce any discomfort from the procedure. And I'm just going to get you some goggles and put these around your face to protect your eyes. You can use this, your cooling hose there to help to cool the skin, and I'll use one as well. I've got one built into the laser here. Okay, so just let me know how this feels. How does that feel?
Can't feel anything.
Oh, good.
Yeah.
That's a really good sign. Usually patients do feel a little bit of a hot and prickly sensation. Michaela hasn't felt a lot so far. That's a good thing. So what I'm doing here is putting down multiple passes of this laser in different directions. And what that does is ensure good coverage of the face. With each pass, the laser is actually laying down thousands of little dots of energy, or little columns of energy, which go into the skin. And these little dots of energy are what break down the pigmentation, remodel the skin, and rejuvenate the skin. The light and the rollers actually track the skin and lay down a particular number of dots depending on the speed of the movement. So you get a very, very even result. So how'd you go, Michaela? How'd you feel?
Great. There was no pain at all.
Good.
It's a bit ticklish, but besides that, no, it was good. And just a bit
Excellent.
cold.
Yeah.
That's
Okay.
from the blood, but no pain at all.
You can see her face is a little bit red, but certainly there's not a lot of swelling or redness. And in a few days, this will all sort of crust up a little bit and peel off and sort of bring out a new skin. So the total downtime, anywhere from 3 to 5 days.